The $1.8 billion one-man drug empire. One guy is about to do $1.8 billion in sales this year, selling weight loss drugs, and he doesn't make the drugs. His name is Matthew Gallagher. His company is called Medvi, and the widest part, he doesn't have a factory. He is not a doctor. He doesn't ship anything. What he does have is a website, a credit card form, and absolutely unhinged ability to make people click buy now on prescription GLP-1s. Here's how the whole thing works. You go to the Medvi site, you fill out some forms, a doctor reviews your forms, but that doctor, not Gallagher, that doctor works for a company called Care Validate, a telehealth in a box platform that provides the doctors, the pharmacists, the prescriptions, the compliance, and ships the drugs. Gallagher didn't build any of that, he just plugged it into it, like an API for human medicine. And the drugs themselves? Care Validate gets those from actual drug manufacturers who have actual factories with actual workers. So what does Gallagher do? Branding, marketing, search engine optimization. He uses AI to build the customer funnel and then let everyone else handle literally everything else. His brother helps. He has some contractors. That's the team behind a potential billion-dollar revenue company. Sam Altman, yeah, the OpenAI guy, predicted in 2024 that one-person billion-dollar company would happen. Said it would have been unimaginable without AI. Well, he's saying Gallagher might have won him a bet with his tech CEO friends, and that he would like to meet the guy. I would also like to meet this guy, because what Gallagher figured out is that the entire drug supply chain, manufacture, medicine, logistic, compliance is now just infrastructure you can rent. Like AWS, but for prescription weight loss medication. And here's where it gets genuinely weird. This isn't new. There has been a whole generation of online retailers who do design, branding, checkout, and advertising for products made entirely by factories they've never visited. That's dropshipping. You buy it for $98, sell it for $100, your revenue is $100, even though you created exactly $2 of that value. Gallagher is running the same playbook, except instead of sneakers or supplements, it's GLP-1's weight loss injection, which are regulated pharmaceuticals which require a licensed physician to prescribe. He just found out a company that rents him licensed physicians by the click. And honestly, this is the part that keeps me up. Not that one guy got rich, but that we build an economy so modular, so API-able that you can insert yourself between a drug manufacturer and sick person, capture $1.5 billion in revenue, and the question of whether you actually build anything becomes genuinely philosophical. The doctors are real, the drugs are real, the patients are real. The company in the middle, it's basically a very expensive redirect. Gallagher didn't build a drug company, he built the world's most profitable front door to one. And in 2026, that's apparently worth $1.8 billion. The house always wins, even when the house is one guy and his brother.